Hello, everyone, and welcome to the BRMI Symposium. Today, it is my honor to introduce Dr. Jodie Dashore. I am so excited to have you. Thank you for joining us today.
Absolutely, my pleasure to be here.
Yes, wonderful. So Dr. Dashore is going to be speaking about an incredibly important topic. So I am just really eager to launch this and listen to this talk. The topic is immune modulatory effects of camel milk therapy for intestinal hyperpermeability in children with ASD comorbid with PANS. So as many of us know, leaky gut is a clinical condition that is characterized by intestinal hyperpermeability, increase in pro-inflammatory cytokines, alteration in the microbiome, increased expression of tight junction proteins, bacterial overgrowth, immune dysfunction, alteration of luminal factors, and permeability are all involved in the pathogenesis of leaky gut syndrome. Additionally, translocation of microbes and their toxic metabolites can lead to the presence of intestinal bacteria in sterile tissues and distant organs and play a role in the pathogenesis of chronic conditions. Studies have shown that camel milk contains specific beneficial bioactive components like lactoferrin, nanobodies, vitamins, minerals, probiotics, and enzymes that have anti-inflammatory immune modulating properties. Dr. Dashore will talk about the benefits seen with different types of camel milk administered in a structured manner at predetermined intervals, along with specific supportive herbal supplements with children in ASD and PANS as a novel dietary intervention that may help improve intestinal barrier function, reduce inflammation, strengthen the microbiome, and restrict bacterial invasion for optimal neurological outcomes. This sounds incredible. So I would just like to introduce Dr. Jodie Dashore. She is an internationally recognized practitioner, author, researcher, and pioneering clinical herbalist. She's widely known for her unique plant-based medicine approach to autism, Lyme disease, mold biotoxin illness, and chronic inflammatory response syndrome, and camel milk medicinal protocols. Dr. Dashore holds a PhD in integrative medicine and has recently completed a postdoctoral certification in immunology at Harvard Medical School. Dr. Dashore is a Shoemaker certified practitioner, board certified in integrative pediatrics, is a board certified and licensed doctor of occupational therapy, neurology, board certified holistic health practitioner, and a registered herbalist with the American Guild with over 25 years of clinical experience. She specializes in natural, plant-based, and individual genetic-based customized treatment options for autism, Lyme disease, and mold biotoxin illness. She's the founder and director of BioNexus Health Clinic, Apothecary, and Biodynamic Herb Farm in Marlborough, New Jersey, and Lancaster, Pennsylvania. The practice is dedicated to scientifically formulated plant-based treatment options, herbal compounded apothecary formulations, along with therapeutic camel milk protocols for patients of all ages, and works with families in over 73 countries worldwide. The BioNexus herbal line of proprietary formulations are available to practitioners worldwide. Dr. Dashore is the author of the book, The BioNexus Approach to Biotoxin Illness, a step-by-step guide to sustainable plant-based treatment options. Incredible. Thank you for all of the good work that you're doing. What an impressive and broad array of the background and how you're pulling together all of these important pieces of traditional medicine as well as science to really advance a topic that is dear to so many of our hearts, especially in children. So welcome. I will hand it over to you. Take it away, Dr. Dashore. Thank you for joining us today.
Thank you, Tia. It's awesome to be here. So I'll be speaking today, like Tia said, about the immune modulatory effects of camel milk therapy for intestinal hyperpermeability in children with autism spectrum disorders, comorbid with pediatric autoimmune neuropsychiatric syndromes. Now, ASD and gastrointestinal pathology. I'm sure we all know by now that autism spectrum disorder is a complex disorder characterized by deficits in social communication, social interaction, restricted and repetitive patterns of behavior, interests, or activities originating in the early developmental period. In 2023, data collected shows us that unfortunately 1 in 36 children will be diagnosed as being somewhere on the spectrum. A large number of children with autism exhibit various gastrointestinal symptoms, such as constipation, diarrhea, food allergies, food sensitivities, malabsorption and maldigestion problems, metabolic syndromes more frequently than normal children. Several studies have been done to the effect. One point to note is I will not be elaborating each slide to stay time sensitive, but I will make this PowerPoint available for those of you that are interested. Children with language regression, children with autism, that is, with language regression, interestingly enough, more frequently exhibited an abnormal stool pattern. They also had an increased family history of autoimmune disease like celiac disease and/or inflammatory bowel disease. Let's talk a little bit about BioNexus Health statistics in my practice. So approximately 42% of my total clientele have autism spectrum disorders. Approximately 85% of those also have PANS, and approximately 92% that have ASD and PANS also have gastrointestinal issues. So a lot of experience in that arena. ASD families report complex health issues, gastrointestinal issues, bloating, gas, diarrhea, IBS, autoimmune disease like rheumatoid arthritis, lupus, celiac, psoriasis, allergies, asthma, depression, anxiety, other mood disorders, trouble thinking, brain fog, concentration, remembering, learning, inflammatory bowel diseases such as Crohn's and ulcerative colitis, blood sugar issues, including diabetes, eczema, acne, and other skin conditions, insomnia and other sleep disorders, obesity, and difficulty losing weight. So, it might start with helping a child recover. We are now in more than 89 countries in the world. And it ends up, eventually once the child starts to get better, Tia, we end up seeing the whole family from the child to the grandparents often. Leaky gut syndrome and the pathogenesis of disease, bacterial overgrowth, immune dysfunction, alteration of luminal factors, altered intestinal permeability are all involved in the leaky gut syndrome. TNF alpha and interleukin 1 beta are the chief pathogenic factors seen in intestinal inflammation. So these cytokines will induce initiation and amplification of inflammatory cellular processes in the gut. There is strong evidence suggests a correlation between leaky gut and both gastrointestinal and non-gastrointestinal diseases such as IBD, IBS, liver disease, colorectal cancer, food allergies, Huntington's disease, and Parkinson's disease as well. Over 70% of your immune system is in the gut. That is your GALT, or the gut-associated lymphoid tissue. So when there is leaky gut, the symptoms that we see would be along the lines of fatigue, sleep disturbances, gut inflammation, dysbiosis, bacterial translocation, systemic inflammation, nutrient malabsorption, endocrine hormonal imbalances, metabolic disorders, mood disorders, brain fog, and detoxification challenges. Let's look at some of the important biomarkers that I look at when I treat leaky gut. Alpha melanocyte stimulating hormone and gut inflammation connection. The pro-opiomelanocortin derived peptide, that is the alpha MSH, is known to modulate or regulate inflammation in the body, especially the gut. The alpha MSH significantly downregulates the LPS mediated activation. LPS is lipopolysaccharide mediated activation of NF-kappa beta in a dose-dependent manner, right? So higher the bacterial and inflammatory lipopolysaccharides, the higher the function of alpha MSH. So it works in modulation. Another biomarker that I look at is beta-glucuronidase, the intestinal version. Beta-glucuronidase is a bacterial enzyme that limits the excretion of compounds from the body, such as medications, hormones, neurotransmitters, environmental toxins. What it does is it reverses a detoxification process known as glucuronidation. So what happens is it can hydrolyze the glucuronidated metabolites to their toxic form in the intestines, resulting in intestinal damage. So that is one marker that always interests me. Let's talk a bit about autism and milk casein. So many studies have found an immunological malfunction in children with autism that affects the specific intestinal enzyme responsible for degradation of milk casein to amino acids. So instead of two caseins, which would be beta-lactoglobulin and beta-casein, they are broken down into beta-casomorphin 7, which is a known opioid receptor agonist. So you will see, OCD, oppositional defiant disorders. You will see many other symptoms which can be attributed both to autism and PANS. This casomorphin can account for many of the behavioral manifestations of autism. Camel milk. So camel milk is the closest to human mother's milk. It helps decrease the serum level of thymus and activation regulated chemokine, the TARC as commonly known, and macrophage-derived chemokine, the MDC, in some autistic children, which helps to decrease the Th2 dominance. And this additionally, Th2 dominance holds significance in children with PANS as well, with or without autism. So camel milk is a highly nutrient-dense milk with high amounts of bioavailable vitamins, minerals, antioxidants, proteins, insulin, and many unique antibodies. The most important proteins would be the whey proteins, which contain albumin, lactoferrin, and immunoglobulins. It's interesting to note that camel milk has more antibodies than human breast milk, and they are 10 times smaller. That's why they're known as nanobodies. Briefly, I won't go into details here. So I have highlighted the general composition of camel milk. So you'll see the fats, the lactose, the vitamins, and the proteins. So the proteins, again, it's important to note, they do not contain allergens. There's no ruminant beta-casein or beta-lactoglobulins, but they do contain insulin and a number of other protective proteins. Let's talk a little bit about the immunoglobulins in camel milk. So they are similar to immunoglobulins in breast milk. In fact, in Africa, Asia, Middle East, where camel milk is very much a part of their indigenous culture, many diabetics, they treat themselves with camel milk using milk purchased locally, from pastoralists and nomads. Camel milk contains up to 150 units per ml of insulin. Now, goat milk and cow milk do have some insulin, but that is degraded in the acid environment of the stomach. Now, this does not occur with camel milk because camel milk does not coagulate in the stomach. What are the beneficial properties of camel milk proteins for autism patients? They are smaller, more effective than those of humans and ruminants. Protective proteins are mainly enzymes, and enzymes, as most of us holistic practitioners know, they have medicinal properties. The most effective immune support protective proteins in camel milk are the lysozymes, immunoglobulins, lactoferrins, and lactoperoxidase. This slide will again be brief. It highlights the anti-inflammatory effects, the antioxidant effects, and the immune modulatory effects. and the mechanisms of all of those, including one double-blind study which was done in ASD patients. It's interesting, for those of you watching, just give this slide a read. It will be pretty eye-opening. All right, camel milk nanobodies. Now, human antibodies, are relatively, microscopically speaking, of course, but relatively huge, Y-shaped, and they are often described as magic bullets. But by molecular standards, they are more like tanks when it comes to, comparing them with camel milk nanobodies. So nanobodies are 1/10 of the size of human antibodies, and that allows for greater penetration of the antigens. Camel milk antibodies can grasp their targets just like human antibodies. These antibodies remain active when passing through the stomach. This is, like I mentioned before, due to the fact that camel milk proteins do not precipitate in the stomach. So it passes untouched into the intestines. So, when you have yeast overgrowth, small intestinal bacterial overgrowth, additional bacterial overgrowth in the large intestine and the colon, this is where the benefit happens. This was a BioNexus Health study. We had 33 patients with ASD and PANS in the following countries: USA, Canada, UK, South Africa, Serbia, Pakistan, Qatar, UAE, and India. The age range was between 2 and 12 years of age. The ATEC scores for autism were calculated for each child prior. The PANS diagnosis was confirmed using the GAO and Shoemaker criteria, along with the usual PANS criteria. The reason why I mentioned the Shoemaker criteria, because one of the largest triggers for PANS that we found in this population was CIRS, the chronic inflammatory response syndrome, or mold biotoxin illness. We had gastrointestinal discomfort scale was used. The symptoms were noted. Camel milk was added to the dietary regimen as per the BioNexus copyrighted camel milk protocol. That's coming soon. The patients were monitored with observations documented along with repeat labs and their usual regular scheduled follow-ups. Here is another point that we evaluated and kept in mind: folate receptor antibodies, because the first question that comes to practitioners, hey, what if my patient it has a folate receptor antibody? Can we still do any kind of dairy? So here's the information. Folate receptor antibodies, the FRAT test, is important for every child with ASD prior to introducing any milk products, except, of course, the human breast milk. The FR antibodies, the autoantibodies, the blocking and/or binding are associated with a disruption of brain development and function. Now, current evidence suggests that these antibodies may be responsible for reducing the transport of folate and its active metabolites, most notably the 5-MTHF, across barriers to the brain and placenta and ovaries during pregnancy. The methyl tetrahydrofolate, that's the 5-MTHF. Now, the precautions that we use for those patients that are FRA positive would be for moderate to high results, meaning moderate to high FRA positive. Avoid using all milk products. Camel milk may be used medicinally as below. So avoid camel milk till gluten, other food sensitivities, inflammation, and infection have been resolved, or at least treated and sort of under control. Start camel milk low dose, 1 teaspoon, and very slowly build up to half a cup once a day. Use only the flash pasteurized camel milk. So this was for moderate to high. Now coming to when the patient has low FRAT results, it's okay to use camel milk as below. You can start low dose, 1 tablespoon a day, and add 1 tablespoon every 3 days, build up to half a cup twice a day in this case. Start with flash pasteurized just for the first 4 months, and then slowly introduce the raw camel milk, obviously with informed consent, and from a reliable source, and introduce raw with the same slow buildup. This is the BioNexus Camel Milk Protocol. Just to give you a background, I've been using, people who know me know that my only child, my son, is fully recovered from severe autism, nonverbal, along with PANS, PANDAS, lower body paralysis, Lyme disease, co-infections, SIRS. He's fully recovered, and we've been using camel milk. This is how, my entire practice, all of the BioNexus herbals, etc., came from my son Brian's recovery journey of 7.5 years, a lot of research. So this is what we use for him. We still use camel milk. I use camel milk. Brian uses it every single day. And right now we are using raw for about, 15, 16 years now. But this is how we started as well. So consider FRAT results, then minimum 6 months on a GF gluten-free, casein-free diet. Start with herbal drops twice a day for 1 week. Then add in the flash pasteurized camel milk. Start with 1 teaspoon camel milk once a day after food. Next, make that 2 teaspoons once a day after food, and keep building up. Eventually build up to half a cup of camel milk once a day. Once you reach half a cup once a day, at this point, I like to add in a binder. Then I like to add in liver support. Then after that, add in your favorite probiotic, not more than 5 billion CFUs, and only 3 days a week is what we've seen the best results with. So on Sundays, typically leave the gut alone, no probiotic, no camel milk, rest day for the gut. If this is well tolerated, then you can slowly move on based on the FRAT guidelines in the previous slide to half a cup twice a day after food. Now stay on this regimen until your next appointment. Report any Herxheimer or die-off reactions. It's important to take careful note. And after 4 months, it is okay to consider the raw option. After 4 months on flash pasteurized camel milk, for those with low FRAT antibodies, it's okay to consider the raw option. Discuss with your practitioner. Practitioners, remember to obtain informed consent. Okay, so herbal glycerids, not tinctures, 1 ml daily in 2 divided doses of the following: fennel, ginger, peppermint, holy basil, ashwagandha. Ashwagandha needs to be avoided if a child has severe PANS or is going through a PANS flare. Milk thistle, dandelion. And as an option to all of the above, BioNexus patients usually get the BioNexus gastrointestinal support blend and the hepatic support blend. The binder options we use is activated charcoal, chlorella, and bentonite clay. BioNexus patients get locally made, and all of the BioNexus herbals are biodynamic, so beyond organic, and they are handmade in small artisanal batches. So the binder we have is okra. It's Okra Max. It contains okra and a few other biodynamic binders in there, and it's a pretty mild binder. So that is another option for BioNexus patients. Not going to go into detail, but this is Clark's rule, the famous Clark's rule to calculate herbal dosage. So please do pay attention, especially if you are using the herbals for adults, older adults, seniors, and children. So this is dosages for 60 years and older, briefly. 60 to 65 standard dose is fine. 65 to 75 would be 5/6 of the standard dose. And age 75 plus is 2/3 of the standard dose. Okay. I included this slide because many have asked me, why do you need liver support with leaky gut syndrome? So liver cell damage may occur as a result of bacterial or endotoxin translocation from the gut to the liver, small intestinal bacterial overgrowth, colon infections, inflammation if you have Crohn's disease, ulcerative colitis, IBS, IBD, Additionally, many patients I see have Helicobacter pylori overgrowth. So the endotoxins from bacteria, sometimes the bacteria themselves can translocate to the liver, and it greatly hinders the innumerable important functions that the liver has in our body. So that's the reason for liver support. The labs I monitor is transforming growth factor beta 1, beta glucuronidase, the SIG-A levels, the secretory immunoglobulin A levels, the Candida IgG, IgM, and IgA, zonulin, and eosinophil activation protein. This was the study with the 33 patients that I mentioned earlier, and the improvements reported that we saw was bowel movement. We saw improved regularity, frequency, consistency, and color, reduced GI pain or discomfort, reduced or eliminated, in fact. Food intolerances and sensitivities reduced and or eliminated. Mood and behavior, we saw improvements in attention span, hyperactivity, sensory seeking, self-calming, eye contact. Improvements in expressive and or receptive language. Receptive language improvements were far greater than expressive, but expressive language improvements when seen are phenomenal. So, can't get into that right now, but language is a very complex issue with the nonverbal children in autism spectrum disorders. And after Camel Milk Protocol, I usually end up using the BioNexus speech protocol. So we have a completely herbal regenerative protocol known as the speech protocol, and that, once again, we see fantastic results. In this study, the ATEC scores dropped 6 to 17 points, and with the repeat specialty labs that were run, we saw reduced pathogen loads. These are long list of references. Thank you very much.
Wow, Dr. Dashore, thank you so much. That is, I think everybody in the audience is going to be so grateful, as am I, to have these slides, right? As a way to kind of go back and go through all of the really important information you've given us with your protocols, also the data and the literature. You just took a lot of, I would say, complicated details of what we see with patients that also end up translating into a clinical picture that is so challenging for people to deal with in a way that patients and their families are getting good results. So, I mean, my goodness, I just want to share my gratitude. And it sounds like you must have gone through an incredible transformative journey with your son that really inspired you to do such incredible work and to bring the gut and the mycotoxicity and all these pieces together. I think that that's why we're seeing such a rise, of course, because of toxicity coming from different places. But when we're treating chronic illness with multi-systems involved, it becomes so complicated for the practitioner, for the family, because you're seeing so many different specialists, and to really heal and change what's going on in the gut involves some dietary changes. I'm so excited to learn more about camel milk specifically, and to, as I say, go back through these slides. So my goodness, what amazing work you're doing. Thank you.
Oh, absolutely. Thank you so much. Yes, it was, at one point, my son was given 2.5 months to live because he was 52 pounds soaking wet and he was losing a pound a day.
Wow.
So we took a really deep dive into the gut. I mean, I don't think I slept for weeks.
Yeah.
And this is where the information, you won't find too many crazy moms that go and buy an organic biodynamic farm to grow the own herbals and start making, herbal products. But I've been blessed to have been able to mentor with the likes of Stephen Buhner, his partner, Julie, and I do have an Ayurvedic background from India as well. So it just amalgamated into bringing Western herbals with the Ayurvedic knowledge that I've had over the years. And it just came up with this beautiful herbals that I was able to produce for Brian, and then eventually extrapolated them to my client population. And now I don't know, I've lost count. I kept count at 89, but it's such a huge privilege and blessing to help families in so many different countries.
An unbelievable privilege. And I just think it's such a beautiful gift to the world when you do take your pain and suffering, whether it's in for the loved one or something that you are personally going through, and use it as that inspiration and motivation to create something that offers healing, really in your case, to the planet. And what a beautiful way, because so many things are going on around the globe, but also very specifically with the polarization of medicine. And you're giving such an inspirational experience about how to, as you said, tie the research and the science and what's gone on in conventional medicine with an Ayurvedic background, with herbal and botanical medicine, and then with, bringing it all the way back to Hippocrates, which is that disease begins in the gut. And so to pull these different things together to really take what's best from all of these disciplines and create kind of a recipe in a certain way for healing of something that is so challenging, and unfortunately we'll be seeing more of as we move forward in our society. Just I'm very grateful for this talk and this information. So as you mentioned, the slides will be available to everybody, correct? Yeah, there's a lot of, I would just recommend to the audience really to kind of go slowly through it, because just all of the references, the research that's there. And then, as you mentioned, the importance of the herbal botanicals, binders, liver support. And I love what you said about Sunday as a rest day for the gut. I think we hear about things and then we say, oh, well, probiotics are a great way to alter the terrain, to work on the microbiome. And then some people are taking them, daily, forever. And in your approach, we see that rotation is important, rest days, titrating up, maybe titrating down, depending on Herxheimer reactions, because everybody's unique.
That is correct. Yes, too much of a good thing is not a good thing.
Correct. Yes. Yes. Oh, well, wonderful. Thank you so much for joining us today. I really appreciate all your wisdom, your expertise. I am excited to learn more about BioNexus myself and to stay connected with you, and to think about much of what you mentioned in my work with patients. And I imagine that everybody in the audience will too. So I am very, very grateful, and keep us posted through BRMI about all of the good work you're doing.
I will, absolutely. Yes, it was an honor to be here. Thank you for having me. Appreciate it.
Great. Okay. Thank you so much.